Nesbitt.
Good
How are
morning.
you doing this morning?
I'm okay.
All right. My name is Crystal, and I'm from William Carey, and doctors ordered for us to do some tracheostomy suctioning. Would you like that? I heard you've been coughing a lot this morning.
Yes, please.
All right. Well, I'm going to check your identification. Can you tell me your name and your date of birth?
Mary Nesbitt, 2/29/1812.
All right, that's correct. Do you have any questions for me before we begin?
Can I have my coffee after this?
Yes, ma'am. I'll be sure to go get you your coffee.
Okay.
All right. Do you have any allergies?
No, I don't.
No? Okay. I'm going to start by listening to your lung sounds. You take a deep breath in for me. Good. Yeah, I can hear you have a lot of buildup in there. All right, well, I've prepared all my supplies. I'm going to wash my hands, raise the bed to the position of my waist, don my mask and gloves. I will also drape my patient with a chuck pad, just so you don't get a nice nightgown, anything on it. And I have already opened up my normal saline. I've left the cap on, so it's easier for me to get to it. I will open up my suctioning kit, prepare the saline bucket, remove and put on my sterile gloves. Alright, I'll be demonstrating how to do sterile gloving technique. I've already washed my hands, and I have my size 7.5 gloves and one extra pair just in case. I want to make sure to prep this on a surface that's dry, keeping a 1-inch border that's sterile. These gloves are latex. I would make sure that my patient doesn't have a latex allergy. Picking up using the cuff, making sure not to touch the glove. And now only touching the sterile portion of the glove. And then I'll keep my hands above my waist. Sterile. Remove the suctioning catheter. Alright, I'm ready to contaminate my non-dominant hand. I will remove the lid, flip the saline, and then pour it into my saline bucket. I will take the suction catheter and connect. Now I will hyperoxygenate the patient. Are you ready, Miss Nesbitt?
Yes, ma'am.
Alright. Moving this. I will test to make sure the suction is working. I will not suction on the way down. Go until I meet resistance and my patient starts coughing. Pull back a little bit and then begin to intermittent suction on the way out for no longer than 10 seconds with a swirling motion. Here's your oxygen. Clear the catheter. Allow the patient to have oxygen for 30 seconds to about a minute. Alright, we're going to begin suctioning again. Hyperoxygenate, move. Does that feel much better?
Yes, thank you.
You're welcome. Alright, I have finished. I no longer need to be sterile. I will dispose of my suction catheter into the trash can. I will clean up my patient, anything that may have gotten onto her. Remove the drape. Wash my hands. Apply clean gloves. All right, Miss Nesbitt, I'm going to listen to your lung sounds real quick. You sound much better. I will lower the bed, check if she is in any pain, if she's in a position of comfort, if she needs any of her personal items, and if she has to use the bathroom. Do you have any questions for me, or do you need anything from me, Miss Nesbitt?
No, just waiting on my coffee.
All right, I'll go grab it for you.
Thank you.
Wash my hands. If my patient were to have an endotracheal tube instead of a tracheostomy tube, and we needed to do suctioning and mouth care, it would be essentially the same as tracheostomy if they didn't have the inline suction, so we would do the same procedure, but for this one I'll show. For inline suction, you have it connected, and this has a safety device. So you flip it and insert it after you've hyperoxygenated the patient, of course. Insert it all the way in until you meet resistance or the patient shows distress, and then intermittent suction on the way out. And you can do it a total of 3 times. And also, this would be connected via the ventilator suction. We have a Yonker tubing. You can suction in the mouth on the way out. Can't really fit in this one. And we also have a mouth care kit, connecting it to the toothbrushes. These have suction as well, if needed. So go in to clean, doing mouth care at least every 2 hours. Good morning, Mrs. Nesbitt. How are you doing today?
I'm okay. How are you?
I'm doing well. My name is Crystal and I'm from William Carey. The doctors ordered for us to clean your cannula in the tracheostomy. Have you had that done before?
Yes, I have.
All right. Well, can I have you verify your name and your birthday?
Mary Nesbitt, 2/29/1812.
That's correct. Do you have any questions for me before I begin?
I don't think so.
No? Okay. Do you have any allergies also?
No.
All right. Well, I'm going to raise the bed, put down the side rails, continue to have my patient on oxygen with the trach collar, wash my hands. I also have to put a mask on and a gown. I've gathered my supplies. I have normal saline and peroxide, emesis basin just in case, a drape for my patient, which I'll put on, and the tracheostomy cleaning kit. I will begin by opening up my kit, removing the sterile field, maintaining a 1-inch border, I will also remove my gloves, and put those on. I'll dispose of them here. I will empty the contents of the tray onto the sterile field. We have our trach collar, fenestrated drape, and some gauze for cleaning, pipe cleaners, Q-tips. I am now ready to contaminate my non-dominant hand. I will use the peroxide and the normal saline, pouring them into the different chambers. One chamber will contain half and half normal saline and peroxide, and then the other 2 will just be normal saline. And now with my non-dominant hand, I will remove the oxygen. We're going to begin now, Miss Nesbitt. And remove the trach. There it comes. Drop this into my bucket, replace my patient's oxygen so that she is not deprived. And now I will begin cleaning the cannula. The only portion of the cannula that needs to remain sterile is this portion here, and I can touch this portion with my non-dominant hand that is no longer sterile. I will use pipe cleaner, dip it in, clean on the outside, and also clean on the inside. Are you doing all right?
Yes.
Okay. We'll rinse, dispose of this. And now I'm ready to insert the cannula again. I will remove her oxygen. And give her some oxygen. The sterile portion of this procedure is now complete. I can continue with this procedure as in the clean mode. Once she has gotten enough oxygen, I'll remove so I can clean underneath. Remove the old gauze, dispose of that. Can clean around underneath the piece, checking for any skin breakdown. Use my gauze. Are you doing okay? Do I need to give you some oxygen?
I'm okay.
Okay. You should be getting this trach removed soon, correct?
Yes, hopefully.
And now I will prepare the tie before I remove the old one, as to not allow the trach to be removed. Checking for any skin breakdown. Dispose of this. And lastly, apply a new fenestrated drape. I'll give my patient her oxygen back. Remove the Trex bag, dispose. Are you feeling okay?
Yes.
All right. I will lower her bed and check to make sure she doesn't have to use the bathroom if she's in any pain, if she needs any of her personal items, and that she's in the position of comfort. I'll clean up my supplies, dispose of it, wash my hands.